Good afternoon. Thanks for tuning in today to our continuing Clinic Innovator series. With us today is Dr. Brian Abelson from Kinetic Health. Hi, Dr. Abelson. Thanks for joining us today. And we have, as usual, our CEO, Rohit Joshi, who will talk a little bit more about, kind of expand beyond Dr. Abelson's experience and talk about, what we see across the spectrum of users. I do want to point out, as we're getting started, there is a questions submission panel in your GoToWebinar control panel that should be on the right of your screen. If you click that, you can submit questions as we go along, and we'll reserve about 5 minutes at the end to get to questions. So with that, I want to introduce Kinetic Health. So internally, Kinetic Health has 13 users. I believe the majority of those are staff. Dr. Abelson, you can remind me of the distribution there. But I think that's great. We see a different range of users in SecureMail and who's actually who's using it. Some clinics, have one user, and some clinics have everybody on staff with their own account, which is really good and really how it is intended to be used. And you're sending right now about 75 messages a month. I know you're ramping up, and you've got a number of programs in place. Videos that you've put up on your YouTube channel to help patients understand how and why to use SecureMail. And if you could just talk a little bit about these use cases that we talked about and how it fits into your practice.
Actually, we found it a great tool because we've already been, before using SecureMail, we were sending out regular mail, snail mail, and of course there's a slow return time. When somebody comes in for initial examination, we do a general summation, give them key relevant information in terms of our orthopedic neurological tests, treatment plans, and basically give them some timelines in terms of how long we're treating them. But we can get this out really fast since we've actually got on with SecureMail. Also, we send out exercises, and sometimes, of course, physicians want to know exactly what we're sending out, so we actually send links and very specific things so they can, if they choose to, can click on things and they can actually see what we're doing. Yeah, it's been a great tool.
Yeah, and can you just talk a little bit about the services that you provided at your clinic? So you're a chiropractor. What else do you do at Kinetic Health?
Well, we're chiropractors, so obviously we're treating a lot of joint dysfunction, but also soft tissue. My background is also in terms of teaching soft tissue courses for about 13 years. I was an instructor in ART, but we also write books. Besides the chiropractic aspect, we also have registered massage therapy, myofascial work, acupuncture. So total focus on musculoskeletal injury. And so part of our process is making sure that patients actually fit into that paradigm, and anything outside of that, we make appropriate referrals.
Great. So I want to just move on to talking about the benefits of team-based care. Now, this is, talked about a lot in different articles, different circles. We see it at conferences a lot. And I just want to talk quickly about the benefits. Timely access to care, treatment adherence goes up, improved management of chronic conditions. When you're expanding the expertise that patients have access to and the collaboration amongst those expertise. We did a webinar a few months ago about e-consults and the sort of benefit that shows. Can you talk a bit about how you see team-based care benefiting your practice, your patients, and the system?
I think it's incredibly important. Besides chronic cases, we also have cases that are coming in that are fairly acute, and we may come up with a certain way of treating these individuals, but the person is in so much pain that they actually wouldn't be able to make their appointments, or they wouldn't be able to adhere to their exercises or sleep that well. So I have to actually work in conjunction with a medical doctor, someone whose scope of practice involves prescribing certain medications, and they would prescribe that, but I would provide the therapy there. Or, for example, let's say we have someone who has temporomandibular dysfunction. We specifically deal with the soft tissue, but we don't deal with the joint. So I would actually work with the dentist so that they could deal with the specific of the joint. They may be making appliances, dealing with the bruxism aspect, or in terms of occlusion of the jaw and stuff. But without their help, I wouldn't be able to provide the full, complete services that we do. It's incredibly important.
Yeah, I think this goes right to the, right to the vision or the inception of Brightsquid, because what we were trying to do, Dr. Abelson, what we did was we tried to re-envision the health system if we started with the patient. And we took, lots of use cases of different types of patients, and certainly in either an acute or chronic condition, it's rarely isolated to a single practitioner. And so we tried to envision the system and say, well, the providers need to talk to one another. For sure, we have to get better at that. But then within that, we actually have to find a way of getting the provider to talk to the patient in a more unified way. And so it's fantastic to see, like-minded healthcare providers like yourself really embracing that approach, because I think it really does change how patients get care and how health providers, all we're doing is, we're giving you the tool, but how health providers are actually seeing their own opportunity to change how the healthcare system is delivered.
And I think we in Alberta alone, we have 15 different types of professions and organizations using SecureMail. So it really is kind of uniting the team in that way. Can you talk a little bit, Dr. Abelson, about multidisciplinary care and Road? I mean, you kind of started to, but chime in there as well on how that fits in.
Well, so the nice things are in terms of also accessing net care, some of the imaging we do. They may have seen their physician, the physician may have ordered something, and they'll come see me, and then I can actually say to them, I can actually get on net care and I can access the stuff, and I will actually send them their information through Brightsquid, but I can actually have this conversation where I can explain the technical aspects of their imagery, or I can explain about certain things, or I can also tell them that it's incredibly important that you follow up with your physician on certain aspects. So my focus will be in a specific area, but I can also act as their advocate, and just to make sure they really understand the process and how important it is to work from a multidisciplinary perspective, that I will address certain issues, but other issues need to be addressed by their physician.
Yeah, I love that.
Probably one of the most common.
Sorry, I didn't mean to interrupt, Dr. Abelson.
I was just going to say some of the most common things when a person will come in and, I will say to them, when was the last time you had your physical exam? And they haven't had one for a long time. And they'll have high blood pressure. I look at their vitals, go through things, and, there could be other issues come on there. And I'll say to them, look, you've got to get your yearly physical. You've got to get these things checked out. You haven't been, actually following through with all the things to, make sure that you're being proactive with your health. So, just making sure that, the proper referral is made.
And I think we're striving where, there's at least a common data set now, whether it's imaging through Netcare or, some of their other blood work on Netcare, there's a sense now that at least we have the common data now. Let each of the disciplines contribute what they can to that discussion. And I love that opportunity, because I think it's a rare one.
Yeah, and Rohit, I know you've had these discussions, but what were patients doing otherwise? Because this is an interesting situation where, Dr. Abelson, you're actually connecting with the rest of the patient's care team. You're messaging the physician with your notes or, referrals and receiving referrals from them through this way. How do patients cope with that otherwise if they're the ones responsible for carrying the information back and forth?
Yeah, I think Jeff, a couple of ways. And it was most striking to me when I was working with a cardiologist who and I happened to meet some of their patients and had interviewed them, and they would have binders of information that they would literally carry around from provider to provider and then append to their own binder of information, because there was no other place to access that, and everybody gave them lots of information and they got very good at asking for it. But even then, there was no centralization of that information. So that's what happened. Or more commonly, people don't remember. They don't know what was said. When Dr. Abelson's finished treatment, they'll remember a very small bit of what Dr. Abelson said, which makes that outreach really important. And it's not about Dr. Abelson. This is with your doctor the dentist, and so on. There's been studies that have been specifically done saying, well, how much do they recall of what was actually discussed with them? And it's usually very, very little, because it's a bit of a pressure situation when you're seeing your doctor, your chiropractor, your dentist, and so on. And so to have the ability to follow up with the document or next steps, or even just a recount of what we talked about, is super important for the health of that patient.
Yeah. Yeah, I think the stats I've seen are somewhere around 30 to 80% of the information patients are told in an appointment is forgotten by the time they're in the parking lot. Which is staggering, and I think when we rely so much on patients to carry that information forward, it's really hard if it's just being communicated verbally.
Yeah.
So I want to talk quickly just before we get to questions. We hear about what about email? Can email fulfill this purpose? And hopefully we all know by now that email is not a compliant way to transmit information. It's just a quick illustration of why and how it works. But every arrow in the email diagram and every little question box is a potential way or place where information can be intercepted. Not to mention, email can show up in an inbox and be visible to everybody's family member or anybody who has access to that inbox. Secure mail is more protected. And when you send secure mail messages, it actually doesn't transmit over the regular internet. You're uploading information to our secure servers that are maintained compliant with regulations around the world, with HIPAA, PIPEDA, the Health Information Act, GDPR. And this arrow in here is actually encrypted. So it's a secure way to transmit information where email can't do that. Even if email is encrypted, there's some issues there. So we do get that question a lot. So we just like to explain that to people. There are other places you can get more of these kind of tips. There's a Clinic Innovator section on our website. If you look under the Secure Mail tab at brightsquid.com, you can get more of these tips about what other clinics are doing to use secure mail to advance patient outcomes. We do have a couple of questions I want to get to. And Dr. Abelson, can you talk about the response you get from physicians' offices when you message them about the patients that you're seeing?
Actually, the response is very good. Certain clinics, it's great because certain clinics are already signed on to Brightsquid, and it's actually, communication is quite easy. Other ones, we have to get them actually to sign up for that. But on the whole, the feedback has been very good from physicians. They really do appreciate the fact that we're just giving the information, they can take a look at it, and at the same time, if they're interested in making any referrals back to us, it just gives them a better idea of what we do, that our total focus is on musculoskeletal care. They see that we're evidence-based and people-centered, and we want to actually work in that interdisciplinary community and be collaborative. And I think once they see who we are and what we are, communication is good. So we have a number of physicians who are quite willing to go back and forth with us because of that. And I think this mode of communication is really good, because for obviously a lot of physicians do not want to share information over a non-secure portal. And we also send with them actually a form from Alberta Healthcare and have our patients sign it saying that they have the right to share information with us. So this has been a really good way of moving forward.
So you're open with the consent and taking patients through that process as well. So that's important. And in that sense, and there's one comment here in the question that goes back to that. So, someone said, I was so impressed how easy it is to forward a 300-page file to a different clinic. And that's, that's actually, I think, Rod, you can say that's a big part of the use case that was intended for secure mail.
Yeah, exactly. And the reason we built it the way it was, typically even on a monthly basis, we see, CT scans, and again, we don't see them. We just know that they're of a certain size, and we're the only system that allows that type of access that's available to many of the professions that use us. So that's a great comment, and we designed it specifically for that, with that in mind.
Yeah. So any attachment that you put in secure mail can be up to 500 megabytes per file, and you can have as many files as you need per message. Just to put that out there. The next question, and this will likely be our last one before we run out of time. Dr. Abelson, how do you get patients on the system, and do you find it to be a burden to support patients in secure mail?
It's actually quite a simple process. It's part of the reason why we made some short videos for our patients. Overall, the majority of people are used to dealing with computer. They're already your system is so similar to email to begin with, they really don't have a problem with it. Once they realize the benefits of getting it. Occasionally we'll have some seniors who are not that computer savvy. We have to explain a bit more. But overall, patients don't have a problem whatsoever. There is no issue there.
That's great. Great. Well, that brings us to our time. Thank you so much again for joining us today, Dr. Abelson and Rohit and everybody who's tuned in. We will be sending out this recording and it'll be available here on the Clinic Innovators section. So thanks again and have a great weekend.